As a pharmacy technician, you deal with many different tasks every day, from technical to clerical duties. In order to help you perform your job to the highest possible standards, the American Society of Health System Pharmacists, also known as ASHP, has developed the Basics of Aseptic Technique interactive program course and workbook. This program covers many of the skills, best practices, and responsibilities of your critically important and challenging career. This course is divided into 9 sections and is designed to provide both an overview of the concepts and a primer of the correct procedures and practices of sterile compounding and aseptic technique. Throughout this program, there are times when you will be asked to pause the program and refer to your workbook for additional information, self-testing exercises, and supplementary activities. Because this program takes a practical hands-on approach, instructional information is presented in a step-by-step manner to create a comprehensive and useful overview of the basics of sterile compounding and aseptic technique. It is crucial that you first work through the entire program from beginning to end before focusing on those sections most relevant to the work you do in your environment. For additional information, you are also encouraged to refer to the ASHP Guidelines on Quality Assurance for Pharmacy-Prepared Sterile Preparations. Links to those publications and other valuable resources are located in the back of your workbook. Before going on any further, please take time now to familiarize yourself with the glossary of terms in your workbook. As a pharmacy technician, you will work under the supervision of licensed pharmacists to perform technical and clerical duties in the operation of the pharmacy. Technician duties may include, but are not limited to, compounding, which means to measure, weigh, and mix medicinal drugs, preparing and labeling medicines, filling bottles and vials with the correct medicine and quantity of medicine, issuing medicines to the patients, maintaining inventory, keeping patients' medication profiles on specified records, forms, or computerized systems, and collecting and organizing information for direct patient care, medication review, and department management. Pharmacy technicians must be aware of the necessity for aseptic technique, cleanliness, orderliness, and accuracy in their work and work environment. Let's have a look at aseptic technique. Aseptic means without microorganisms. Aseptic technique refers to practices performed immediately before and during compounding that help reduce the risk of exposure to personnel and patients by decreasing the likelihood that microorganisms will enter the body. As a result, aseptic technique requires specific manipulations for syringes, needles, vials, ampules, removal of packaging, assembling of sterile components, and hand placement. Basic aseptic technique should be used when handling parenteral dosage forms or medications not given by mouth, as well as irrigations and ophthalmics. Medications can be administered to patients in numerous ways. Medications not given to patients by mouth or enterally are referred to as being parenterally administered. Parenteral administration includes intravenous, intramuscular, intrathecal, epidural, intra-articular, intra-arterial, intraocular, intraperitoneal, and subcutaneous routes of administration. Whether in a hospital or home, the correct procedures must be followed when preparing intravenous drug therapy to ensure that the final preparation is safe and effective. Although the parenteral route of drug administration offers many advantages, it also has some unique preparation requirements. Since the drug or solution is being injected directly into the body, it bypasses the body's barriers to infection. Therefore, it is extremely important that the solution be sterile, that is, free from bacteria or other living organisms. Special training is required for all personnel who prepare and administer sterile IV solutions. If a contaminated drug or solution is inadvertently injected into a patient, the adverse effects can be fatal. While IV therapy offers a rapid, direct means of administering many life-saving drugs and fluids, and a high percentage of IV therapy is administered without any problems, there are some risks. Many of the issues addressed in this training program are aimed at teaching proper technique and therefore minimizing the potential for these risks. The following are some reported complications of IV therapy that can increase the risk to patients. Infections can result if a preparation contaminated with microorganisms or pathogens is infused into a patient. Human touch contamination continues to be the most common source of contamination. Although a risk, the incidence of an air embolus is low because many solutions are administered using infusion pumps equipped with an alarm that sounds when air is present in the IV line. When a patient has an allergic reaction to a substance given parenterally, the reaction is usually more severe than if the same substance were given by another route, such as by mouth, topically, or rectally. Some drugs are incompatible with other drugs, containers, or solutions. If an incompatibility exists, the drug may precipitate, be inactivated, or adhere to the container. A visual inspection of the final preparation should always be performed to observe any cloudiness or signs of incompatibilities. Solutions with known or detectable incompatibilities should not be administered to patients. Particulate matter refers to unwanted particles present in parenteral preparations that can cause adverse effects to the patient if injected into the bloodstream. Some examples of particulate matter are microscopic glass fragments, hair, lint or cotton fibers, cardboard fragments, undissolved drug particles, and fragments of rubber stoppers. Improvements in manufacturing processes have greatly reduced the presence of particulates in commercially available products. Similar care must be taken in the pharmacy to prevent particulate matter from contaminating compounded preparations. All preparations should be visually inspected for particulate matter before dispensing. Pyrogens, the byproduct of remnants of bacteria, can cause reactions such as fever and chills if injected in large enough amounts. Because a pyrogen can be present even after solution has been sterilized, great care must be taken to ensure that these substances are not present in quantities that would harm the patient. As the use of parenteral therapy continues to expand, the need for well-controlled admixture preparation has also grown. Recognizing this need, many pharmacy departments have devoted increasing resources to programs that ensure the aseptic creation of sterile preparations. These programs focus on the following main elements: development of good aseptic technique in the personnel who prepare and administer sterile preparations, development and maintenance of a sterile compounding area, complete with sterilized equipment and supplies, and development and maintenance of the skills needed to properly use a laminar airflow workbench. Good aseptic technique is an acquired skill. Pharmacists, technicians, and all those who prepare drugs must be trained in and demonstrate competence in aseptic technique before they are allowed to work in an active compounding environment. Proper aseptic practices may be one of the most effective ways to curb bacteria exposures. We've introduced you to the many tasks that are required of pharmacy technicians in the operation of a pharmacy and the importance of aseptic practices. Now let's begin the program. Now that we have covered the basics of aseptic practices during compounding, let's look at the apparel and procedure for proper gowning. In this section, you will review the key features of a proper gowning area as well as standards for personal garb while working in a pharmacy setting where sterile compounding occurs. The simplest and most economical approach to supporting a clean protocol is a correctly designed gowning area, complete with well-designed change room equipment that keeps personnel on a clean track. A well-designed gowning area includes HEPA-filtered air, typically emitted through a ceiling filter or fan units. This continuous flow of clean air immediately removes contaminants introduced by personnel, as well as particles present even in laundered garments. Failure to maintain the desired particle standard in the change area will lead to clean garments becoming violated. There are a variety of possible layouts for the gowning area. Regardless of the design, all pharmacy staff should adhere to the following guidelines for proper gowning. Don't touch. Most cleanliness violations occur when dirty hands touch a garment or when it touches a dirty floor. Wash and dry hands frequently. Maintain ultra-clean, unviolated surfaces where garments can be donned without contamination. Dress from the head down. This ensures that released particles won't fall on clean garments or booties. Understand garment design. In most instances, gloves and booties are worn over coverall sleeves and cuffs, and hoods are tucked inside collars. Know how to properly seal any gaps between clothing. Check the mirror located in the clean area for final self-inspection. Minimized motion. Personnel wearing clean room garments emit thousands of particles per minute even when sitting still. People in street clothes, walking from one change room location to another, release millions of particles. Just like the clean room, the change room needs to be properly maintained to limit the possibility of exposure. Make regular maintenance a part of the daily routine at the facility. While certain gowning standards are the same for all compounding practices, there are some with a few differences that apply when preparing non-hazardous and hazardous drugs. Standard gowning and gloving practices that should be followed by all pharmacy personnel include: remove outer garments such as lab coats, makeup, and any jewelry. Glasses are an exception and can be worn. Compounders should not wear artificial nails or nail polish. Hair covers should completely cover all head hair. Surgical masks should be worn. If facial hair is present, wear a facial cover. Shoe covers should completely cover the shoes. Wear a clean, long-sleeve garment that generates low amounts of particles and covers clothing. Thoroughly wash and dry hands and arms to the elbow according to the standard procedure. Appropriate long gauntlet-style gloves should be worn. The gauntlet of the glove should be pulled over the cuff of the gown. Because of concerns related to latex allergy of both the patient and the compounding personnel, some institutions are now using latex-free gloves such as nitrile for all IV compounding. For hazardous drug compounding, wear double gloves, one set of standard gloves first, and then a set of chemotherapy-appropriate gloves. Good aseptic technique begins with you. To protect exposed sterile preparations, personnel are expected to consistently maintain sterile gown quality and aseptic technique standards. Wearing protective clothing helps contain both microorganisms and non-viable particles that are generated by employees. Clean, low-lint garments must be worn when preparing sterile preparations. Your facility will provide appropriate gowns for this purpose. Clean room attire may vary based on the type of preparation being prepared, specifically whether personnel are compounding hazardous or non-hazardous drugs. Now stop the program and review Chapter 1 in your workbook. Take the Chapter 1 quiz and test your knowledge of the content in this section. Touching the critical sites of sterile components while compounding is the most common reason for contamination of pharmacy compounded sterile preparations. Proper hand washing is a critical step in preventing contamination. The chemical action of soap, along with the friction of rubbing your hands together, helps rid the skin of dangerous germs and bacteria. Now let's review the importance and proper procedures of hand washing. Before using any equipment or performing any compounding, you should first remove all jewelry, including rings and watches. Then, using warm water, wet your hands and wrists up to your elbows and let the faucet run the entire time you are washing your hands. Now, thoroughly scrub your hands, nails, wrists, and forearms for at least 30 seconds with a brush, warm water, and appropriate bactericidal soap. Be sure to scrub your palms, the backs of your hands, between each of your fingers, under your nails, and around your cuticles. After scrubbing, rinse well, holding your hands upward towards the water so the dirty water and soap runs toward the elbows and not the hands. Hold your fingernails under running water to make sure they are properly rinsed. To finish, use a clean, lint-free towel to dry your hands and use a towel to turn off the water. Now that your hands are cleaned, don't touch anything except for garbing supplies. To avoid recontamination, do not leave and re-enter the compounding area without performing proper garbing and hand washing techniques. Many institutions require the use of sterile gloves to reduce touch contamination, but don't let that give you a false sense of security. Sterile gloves are sterile only until they touch something not sterile. If you must scratch or touch your face while wearing gloves, they will need to be changed or disinfected. Please note that if you have an upper respiratory tract infection, open sores on hands, or any other infectious disease, inform your supervisor or consult your institution's quality assurance procedures. Hand washing is one of the most important ways to prevent microbial contamination. Your hands must be properly cleaned before and after any compounding takes place. Strictly following these guidelines is the first line of defense for protecting against the spread of microorganisms. Now stop the program and review Chapter 2 in your workbook. Take the self-assessment quiz and test your knowledge of the proper procedures for hand washing. To help minimize the risk due to contamination, all compounding must take place within a primary engineering control, such as a laminar airflow workbench, often referred to as a hood, a biological safety cabinet, or a compounding aseptic isolator. Secondary engineering controls, or clean rooms, provide a second level of control of the aseptic environment. First, let's discuss secondary engineering controls, or clean rooms. A clean room, or buffer room in basic terms, is the room that houses the primary engineering controls where the aseptic compounding work is done. The clean room is a specially constructed enclosed area containing one or more clean zones, where the concentration of airborne particles is strictly controlled. Did you know that standard room air typically contains hundreds of thousands of suspended particles per cubic foot? Particles such as dust, pollen, smoke, and bacteria? Sneezing, for example, produces 100,000 to 200,000 aerosol droplets that can then attach to dust particles. Therefore, the control of airborne particles is important. Control of airborne particles is achieved through the use of high-efficiency particulate air filters, known as HEPA filters, continuous air circulation, and a physical barrier to outside or non-filtered air. Clean rooms also maintain appropriate temperature, humidity, air pressure, and airflow patterns. Clean rooms are categorized by their constant air quality, or class. Most simply put, the lower the classification number, the cleaner the air. In addition to the basic components we just discussed, a clean room can also include special filtration or treatment systems for incoming air, ultraviolet irradiation, airlock entry portals, sticky mats to remove particulate matter from shoes, and positive air pressure to reduce contaminant entry from adjacent rooms. You must follow standard operating procedures to maintain the integrity of the clean room. A clean room should be cleaned daily and segregated from normal pharmacy operations, non-essential equipment, and other materials that generate particles, such as cardboard boxes. Traffic flow into a clean area should be minimized. Floors should be disinfected daily with dedicated cleaning materials and equipment, and trash should be removed frequently and regularly from dedicated clean room trash cans. Clean rooms are often adjoined by an anteroom, used for non-aseptic activities related to the clean room operation, such as order processing, gowning, and handling of stock. Secondary engineering controls are only part of the overall process of compounding sterile preparations. Next, we'll discuss aseptic techniques and practices used within the various primary engineering controls. Aseptic technique, that is, methods used to manipulate sterile preparations so that they remain sterile, should be used while working at any of the primary engineering controls. The following principles are important to understanding how to use aseptic technique properly within a primary engineering control. Within a laminar airflow workbench, the space between the HEPA filter and the sterile object is known as the critical area or critical site. First air is HEPA-filtered air that washes over the component in the compounding work area. Because the air downstream from non-sterile objects may become contaminated with particles, a direct path of first air between the HEPA filter and the critical work area inside the hood must be maintained. Your hands should never enter first air or obstruct airflow around the area where the needle enters a vial or ampule. The zone of turbulence refers to the air turbulence created inside the critical area by an object in the direct path of the first air. This zone of turbulence could potentially extend outside the hood, drawing contaminated room air into the aseptic working area. Remember, when laminar airflow is moving on all sides of an object, the zone of turbulence extends approximately 3 times the diameter of that object. And if laminar airflow is not accessible to an object on all sides, the zone of turbulence may extend 6 times the diameter of the object. That's why you should work with objects at least 6 inches from the sides and front edge of the hood, and be careful to keep your hands out of the airflow in the critical area between the HEPA filter and sterile objects. The following list outlines aseptic practices for working in the compounding environment. Remove all makeup and jewelry from your hands and wrists. Be sure to wash your hands and arms before entering the hood. Wear appropriate personal protective equipment such as gloves, gowns, masks, and hair, eye, beard, and shoe covers. Keep your hands within the cleaned area of the hood as much as possible. Do not touch your hair, face, or clothing. Remove excess dust from items before introducing them into the compounding work area, and perform all calculations before entering the hood. Sterile preparations should be prepared in Class 100 environments, which means they contain no more than 100 particles per cubic foot that are 0.5 micron or larger in size. Laminar airflow workbenches are frequently used to achieve a Class 100 environment. A laminar airflow workbench is a primary engineering control or device that provides the following aspects for aseptic compounding: clean air to the immediate aseptic compounding area, prevents room air from entering, a constant flow of air out of the work area, and an outward flow of air that suspends and removes contaminants introduced into the work area by personnel. The most important part of a laminar airflow workbench is a high-efficiency bacteria-retentive filter. First, room air is drawn into the unit and passed through a pre-filter to remove gross contaminants, such as lint and dust. Next, the air is blown through the plenum of the hood and the HEPA filter, and finally over the immediate aseptic compounding area. This twice-filtered laminar layer of aseptic air continuously sweeps the work area inside the hood to prevent the entry of contaminated room air. Let's look at the two most common types of laminar airflow workbenches: horizontal airflow and vertical airflow. Horizontal airflow workbenches sweep filtered air from the back of the hood to the front. An electrical blower draws contaminated room air through a pre-filter, similar to a furnace filter, which removes only gross contaminants. The pre-filtered air is then accelerated to ensure a consistent distribution of airflow through the final filtering apparatus. This final HEPA filter constitutes the entire back portion of the hood's work area and removes 99.97% of particles and airborne microorganisms that are 0.5 micron or larger. As you probably suspect, vertical airflow workbenches have a vertical flow of filtered air. Unlike the horizontal airflow workbench, in vertical airflow workbenches, HEPA filtered air merges from the top and passes downward through the work area. The critical principle of using airflow workbenches is that nothing should interrupt the flow of air between the HEPA filter and the component being used for the preparation of compounded sterile preparations. All materials placed within the compounding work area disturb the pattern flow of air blowing from the HEPA filter. To maintain sterility, nothing should pass behind a sterile object in a horizontal airflow workbench or above a sterile object in a vertical airflow workbench. Let's review the general principles for operating laminar airflow workbenches properly. A laminar airflow workbench should be positioned away from doors, air vents, or anything that could introduce contaminants into the hood. Laminar airflow workbenches should remain on 24 hours a day. If turned off for any reason, a laminar airflow workbench should be switched on and allowed to run for at least 30 minutes and thoroughly disinfected. Before use, all interior working surfaces of the laminar airflow workbench should be disinfected with appropriate disinfecting agent and a clean, lint-free cloth. Cleaning should proceed at a top to bottom, back to front motion, starting at the HEPA filter to move contaminants out of the hood. The hood should be cleaned between each compounding batch and when the work surfaces become dirty. The HEPA filter grill or protective grill should be cleaned carefully in a manner that avoids getting the HEPA filter wet. Nothing should be permitted to come in contact with the HEPA filter. Only objects essential to aseptic compounding should be placed in the laminar airflow workbench. Do not put paper, pens, labels, or trays into this area. Jewelry should not be worn when compounding since it can affect the integrity of personnel gowns and gloves and the effectiveness of hand hygiene. Actions such as talking and coughing should be minimized and, when necessary, directed away from the compounding work area. Unnecessary or rapid movement within or around the laminar airflow workbench should be avoided to minimize the turbulence of airflow. Smoking, eating, gum chewing, and drinking are strictly prohibited in the aseptic environment. Arrange objects to achieve the full benefit of the laminar flow of air. Critical items should be placed as close to the air source as possible. All aseptic manipulations should be performed at least 6 inches from the sides and front edge of the hood to prevent backwash contamination. And primary engineering controls should be tested by qualified personnel